Yeah, sorry about that. We had a little bit of a technical problem. Just picking up on peritoneal dialysis and the advantages of peritoneal dialysis. First of all, treatment can be started more quickly than hemodialysis. Anticoagulants are not necessary. The maturation of the access site and the canalization of the blood vessels is not required. There's less stress on the cardiovascular system because fluid exchanges occur more slowly, and some patients with renal failure fare better on a gentler therapy. Peritoneal dialysis can't be done when there's severe trauma to the abdomen or after multiple abdominal surgeries, especially if there are adhesions in the abdominal cavity, or if the patient has a severe coagulation defect, a paralytic ileus, or diffuse peritonitis. There are several types of peritoneal dialysis, but basically the principle is the same. The dwell times, the schedule of frequency, and the use of a control pump versus gravity flow will vary. The first type of peritoneal dialysis is the continuous ambulatory peritoneal dialysis, or CAPD. In this picture you see examples of the arteriovenous fistula and the arteriovenous graft. Basically what it does is it kind of connects the arterial or the artery with the vein. The blood bypasses from the artery through the graft or through the fistula and then goes into the venous system. So what will happen is the dialysis nurse then will use a needle to access that fistula to be able to get the blood to go through the hemodialyzing machine. And then once it is filtered through there, then it is circulated back into the patient's circulation. Here's another graph of how the hemodialysis procedure works. The blood is accessed by the artery. It's sent through the dialyzer. The waste products are filtered out, and then the blood goes back into the venous system. For peritoneal dialysis, you see here is a picture of the dialysate solution that's hanging in kind of the IV pole type of situation. It's infused into the patient's peritoneal cavity where it sits for a certain amount of time, and then after that time is up, then the solution is drained back out of the peritoneal cavity, and all the toxins and waste products and things like that come out with that solution. So looking at the audience response, question 1, the nurse is sending the patient to dialysis clinic. Pre-dialysis nursing interventions would include withholding anticoagulants, administering antihypertensive medication, assessing the dialysis access site, checking vital signs, and monitoring lab values. So take a moment to look at that, and then we're going to go through the correct answers. Okay, and the correct answer for this particular question are number 1, number 3, number 4, and number 5. The next question is, the nursing care of the patient undergoing peritoneal dialysis includes maintaining aseptic technique when accessing the peritoneal catheter, instilling warmed dialysates slowly, weigh patient before and after dialysis, monitor vital signs, and check color and volume of effluent. And the answer to this question is 1, 3, 4, and 5.